Okay, guys, I have discussion B for you. Now, discussion B is a continuation of today's A topic, which is solo agers and end of life care. Okay, here we're talking about when somebody's passing and their wishes are, what their wishes are, but that makes it complicated sometimes because there's only one person in their life and that's them. They don't have, we're talking about an elderly person who maybe doesn't have any family around in the immediate area, or a widowed person, things of that nature. So let me clue everybody in on end of life care for solo agers. Solo aging raises critical questions about end of life care because a rapidly growing number of older adults are living and aging without spouses, partners, or adult children, leaving them without the traditional advocates who typically navigate medical decisions, caregiving, and emotional support at the end of life. What the surrounding page contents emphasizes, drawing from the context around this headline, the core message is that solo agers, people aging without close family support, face unique challenges. Unique vulnerabilities as they approach the end of life. Several themes emerge from the surrounding material. A demographic shift is reshaping aging. Over 16 million older Americans now live alone, a number that continues to rise. Many are childless or without nearby family, meaning they lack the built-in support system that end of life care has historically assumed. End of life care depends heavily on having someone to advocate for you. The surrounding content highlights that most aging and medical decisions require a trusted person to act on one's behalf. From navigating hospital transitions to ensuring wishes are honored, solo agers often lack a caregiver to assist with procedures or emergencies, someone to monitor changes in health, and advocate to speak up during hospitalizations. A surrogate decision maker when they can no longer speak for themselves. Without support, solo agers face heightened risks. The page content points to several dangers. Delayed or inadequate care because no one notices early warning signs. Threats to autonomy, since institutions may default to creative or unwanted interventions when no advocate is present. Fear of dying alone is a concern voiced by many older adults living solo. Planning becomes both more essential and more complex because solo agers cannot rely on family. They must be more proactive in choosing and legally documenting healthcare proxies. Building a network of trusted friends, professionals, or community members. Planning for long-term care, housing, and medical decision making. Ensuring their end of life wishes are known and respected. 5. The issue is not just personal, it's systematic or systemic. The surrounding content suggests that the rise of solo aging poses gaps in how healthcare systems identify and support isolated older adults, how end-of-life care is structured around family caregivers, how society prepares for an aging population with fewer traditional support networks. In essence, the text signals a growing societal challenge. As more people age alone, our current end-of-life care models built around family involvement are no longer adequate. Solo aging forces us to confront who will provide care, advocacy, and companionship when individuals reach the most vulnerable moments. If you'd like, we can also explore how this theme connects to your podcast work on longevity, meaning making, and emotional realities of aging alone. Solo aging means planning ahead, build legal documents, a local support network, and practical home safety plan so that you can stay independent and avoid being medically or socially isolated. In Pennsylvania, nearly 1 in 4 older Americans live alone. So these steps are increasingly essential. What the page around this title is emphasizing: demographic shift. The guide frames solo aging as a growing reality. Millions of Americans 55 plus are childless or live alone, changing assumptions about who will provide care. Practical independence or not. Practical independence, not denial of risk. The tone balances the beliefs of autonomy with concrete risk, missed health changes, lack of an advocate during hospital stays. Okay. Actionable planning is central. The surrounding content focuses on concrete step-by-step preparation rather than abstract. Reassurance. The key practical steps the guide recommends. Legal and medical paperwork first. Create an advance directive, durable power of attorney, or health and finance, and a living will, so your wishes are enforceable. But copies were trusted. Put copies where trusted people and your primary care clinician can access them. Build a local support network. Identify at least 3 people, friends, neighbors, paid advocates, or community volunteers who can check in, transport you, and act as emergency contacts. Consider formal options like a paid care manager if family isn't available. Make your home safer and easier to manage. Remove tripping hazards, add grab bars, improve lighting, and plan for meals and medication delivery if needed. Small home modifications reduce fall risks and extend independent living. Financial and long-term care planning. Review savings, insurance, and long-term care options. Document preferences for housing and paid care. Plan for who will manage bills if you become incapacitated. Decision points and clarifying questions to guide next steps. Do you have legal documents in place? If not, prioritize a healthcare proxy and durable power of attorney. Who in Pennsylvania can be your emergency contact or advocates? Think beyond family, neighbors, faith communities, and or local nonprofits. Is your home safe for the next 5 to 10 years? If not, consider downsizing or accessible modifications. Risk risks and trade-offs, and how to mitigate them. Risk: dying or becoming incapacitated without an advocate can lead to unwanted medical interventions. Mitigation: legally designate a proxy and share copies with providers. Risk: social isolation increases health risk. Mitigation: schedule regular check-ins, join local senior programs, or use monitored alert systems or services. Quick local action plan for Pennsylvania. Make or update advance directives this week. 2. List 3 local contacts and tell them your plan. Schedule a home safety walkthrough with local aging services or handyman. Okay, guys, that is your B for you. I will jump back on and see if I could do a C in a bit or not. If not tonight, maybe tomorrow. For now, Gator Wellness, I'm going to go take a break. Gator Wellness, take care, folks.